Anxiety. Boy, there's a word that we don't really like to hear. Here's how you know if you have anxiety. And by the way, anxiety tends to be right at the top of the most common diagnoses. Now, when I say that, that actually is above cancer, heart disease, some other medical issues. Anxiety's been now at the top of the list, followed by depression. Now, you know if you have it, if you have some of these symptoms. Anxiety affects my prefrontal cortex. What's that? It's this part of your brain where you make decisions. Have you noticed that when you have fear and anxiety, it's like, I can't make decisions, or it's really hard, or you delay making a decision? That's what anxiety does to us. Anxiety raises the heart rate. Anxiety also will cause your breathing to change. Anxiety tends to cause you to isolate. You move away from people and you tend to make that little cocoon and you try to keep yourself protected, but you probably noticed the more isolation, the more the anxiety. Another form of anxiety is panic disorder. You may be having just a normal day and all of a sudden you notice your heart rate is building, you start to have blurry vision, and it feels like something is taking over. And it feels like, man, I'm having a heart attack. Well, you're not really having a heart attack. 10, 12 minutes later, that panic passes. But it is so fearful, it's so overwhelming that that panic really will keep you then from doing other things because it's the fear of the fear. Now, here's the good news, and there is good news on anxiety. It can be treated, but I want you to look at the whole person. I want you to look at what else needs to be addressed. We can retrain the body if it's having a lot of reactions. We also can look at, okay, do I have a thyroid issue, for example? Do I have a low thyroid function? Do I have other nutrient deficiencies that could be creating anxiety? I need to look at that as well. And it's important that you have a team to help you who are really experts in this area that can look at all those different pieces and put together a comprehensive, I'm going to call it whole person plan, so that you can address all those issues. In the place of anxiety, we can get to a place of peace. And I'm going to use the word freedom because there can be freedom from anxiety. It doesn't mean we, as human beings, don't have it from time to time, but it's not the prevalent emotion that's driving you. Instead, there's a sense of confidence and a sense of peace. And that's what we're all about at the center, bringing it back to the center, that centerpiece of freedom, and there is healing and recovery from anxiety.